Hello YouTube, and thank you for watching. I'm your host Mike, and welcome to my channel. Today we're going to be talking about cervical disc replacement. About 2 weeks ago I had the procedure and I wanted to share the process with you. My intent is to make a series of several videos talking about my diagnosis and how I came to the conclusion of having surgery, what to think and prepare for when you have the surgical process, what happens during the surgery, and of course what to expect afterwards. You will see that there were some mistakes made along the line, and I want to share with you that experience. If you're watching this video, you've probably been diagnosed to have cervical disc replacement, or you've already had the surgery and you're looking for some inspiration on how to get through the process. So anyway, thank you for tuning in, and let's get started. So let's talk about my diagnosis and some of the mistakes that were made along the way. First of all, let's talk about myself for just a second. I'm 53 years old and I've been physically active since the age of 13. I enjoy working out in the gym and I usually spend about an hour, hour and a half a day. Now, many of you will come to the conclusion already that that is what caused me to have my rupture in my neck, and I'm here to tell you that's not the case, and we'll talk about that in just a second. But first, let me tell you some of the symptoms that I had and how I went through the process of going down the wrong path. Basically what happened was I went to bed on a Monday and woke up Tuesday morning with a very sharp pain on my left side. The pain basically ended right here in my shoulder, and it felt like a hot knife stabbing me right here on the side. In fact, it hurt so bad that I took several days off, but then again, I was thinking that I had pulled a muscle or had something to that effect. But after a couple of days, I realized it wasn't getting any better. So I went to a physical therapist to try to find if there was some issue that that person can work on, whether it was massage or some type of impingement. But after a couple of visits, it was determined that it was not that situation at all. In fact, what happened during physical therapy is they had me do something called nerve flossing, and you can Google that to figure out what that is. But basically what was happening is the nerve was moving in my body, and the channels that were blocked were allowed to open up. But unfortunately, because of the pain in my neck was pretty severe, it allowed the energy through the nerve to flow very freely. I woke up the next morning about 3 o'clock and I was in a level 10 pain. In fact, I was in so much pain that it probably would not have hurt my feelings if someone ran over me with a bus. It hurt that bad. But I was able to get it under control and see my physical therapist the next day, and she immediately referred me to a shoulder specialist. Now that was another mistake that was made because, again, my trauma was to my neck, but not in my shoulder. But because the pain was there, she figured that I had some type of injury regarding my shoulder. So when I went to the shoulder specialist, it was determined after an MRI that there was nothing wrong with that. But that surgeon was real smart and finally referred me to a neck specialist. And sitting down with him, I asked him, I said, I've never been in an automobile accident. I've never suffered any trauma to the head or neck. What caused my process? And he said, simply age. That's right. Age sometimes contributes to the fact that you have a degradation of the cervical disc in your spine. And in my case, I had 2 levels between C4 and C5 and C5 and C6. Now, cervical disc, if you don't know, are basically a disc that is filled with fluid. And once that disc ruptures, there's not going to be an opportunity for it to be repaired. So again, the mistakes that I made was I sought physical therapy when it wasn't needed, went to the wrong specialist because the pain was in the shoulder. Finally, and this was a process that took almost 10 weeks, so you can imagine I was very frustrated. And maybe you're having that process right now where you've been to some doctors and they can't figure out what's wrong. Well, you're in the wrong doctor. Definitely go to a neck specialist and find out if you have discs that have been ruptured or maybe even herniated. So in that situation there, I appreciate you tuning into this video. In our next video, what we're going to talk about is how to prepare for surgery and some of the things you need to keep in mind. And again, if you like the video, give it a thumbs up and subscribe to the channel. And I will see you on the next video.